at first.
Okay, welcome everybody to our community conversation, COVID-19 and disabilities. In today's conversation, we will connect the community together to discuss the barriers, myths, concerns, service gaps, and answer questions that exist for people living with disabilities and the solutions, facts, and resources available in the San Antonio community for the COVID-19 vaccine. We do have our restrooms right to the left. A few housekeeping rules. If you could just keep your mic muted, we will open the conversation after a few of our slides, and then that'll allow for you guys to have give us any questions that you may have or ask any of the panelists questions. We do have a survey in your packet that you could fill out if you would please. You will be entered into a drawing to win a $50 HB gift card. We do want to recognize the support of our grant from Texas A&M Health and Texas Department of Health and Human Services. And then we want to thank ConnectAbility for hosting us here today. Today, we are grateful to have with us the following team to share information and join in our conversations. We have Dr. Wu, Medical Director at Metro Health, Danielle Howard, Health Program Specialist, Immunize SA at Metro Health, Sandra Imery, Vaccine Equity Officer at Metro Health, Mikela Viallareal, Community Health Worker at Metro Health, Charlene Baldwin, Outreach Nurse Practitioner at Metro Health, and Antonio Martinez, Disability Life Coach and Health and Wellness Coordinator at Alamo Area Council of Governments. So today we are going to be looking at several different points. Today's conversation, we will look at the impacts of COVID-19 in our community, vaccination rates and effectiveness, how the vaccine works, and then we will also be opening conversations about concerns and access, where to get a vaccine, resources available, and what to expect, and what your reasons are for getting a vaccine. So we're going to go ahead and start with Danielle Howard and Mikela Viallareal, and we're going to just skip a few and then we'll come back to those. So I'm actually just going to come to this one and we will get started. All right, so why get the vaccine? We're going to start with Danielle Howard and Mikela Viallareal. It's up to you.
Just yeah, okay. On why to get the vaccine. We're going to go through the vaccine and the rates of the COVID-19, COVID-19 deaths by vaccination status. You'll see where the red is the people in the community that's unvaccinated, and then in the blue line you'll see the vaccinated people on there. I can't read on that. Stand up. A positive specimen collection. Positive specimen collection data by the end of the week. We're showing the rates by the incident per 100,000 population. The unvaccinated people, age 5 years and older, had now 2.4 times risk of testing positive for the COVID-19 vaccine. Also 9 times risk of dying from the COVID-19, and this was in January. Go to the next one. On this one also, it's also with the, you'll see the difference on the vaccinated and non-unvaccinated. Unvaccinated people from age 12 and older had 3.5 times risk of testing positive for COVID and 21 times risk of dying from COVID-19. I can't read the bottom of the other ones. And then the 3.2 times risk of testing positive for COVID in February. It is compared to people who are vaccinated with the primary series and the booster dose. The vaccine.
So, okay, Mikela, thank you. So we're going to talk about how COVID-19 vaccines work. So basically, COVID-19 vaccines work to trigger an immune response which can weaken or inactivate a germ. So when germs such as the virus that causes COVID-19 enters the body, it attacks and multiplies and causes an infection. And then our body begins to fight off the infection. So with the COVID-19 vaccines, for example, the mRNA, Moderna and Pfizer vaccines, it has ingredients that gives our cells instructions on how to make the protein that is similar to the virus. And then our cells make copies of that spike protein. So later when you are, or if you are exposed to the real virus, your cells will recognize and remember how to fight that virus and destroy it. So basically the vaccine is an extra layer of protection. It was developed to help decrease your chances of severe illness, hospitalization, and even death. So next slide. Or the effectiveness, did I speak on that? Oh, I'm sorry. So the effectiveness of COVID-19 vaccines, vaccinations are the safest and most effective way to protect your health. Federal agencies have found that COVID-19 vaccines they're highly effective. They meet high standards for safety and effectiveness. COVID-19 vaccines, I know there's a lot of concern that the vaccine was developed way too quickly, but in fact, it underwent all the processes as any other vaccine. So vaccines undergo 3 phases of clinical trials. And the only difference with the COVID-19 vaccines is usually the clinical trials are performed one at a time. In response to the pandemic, the COVID-19 clinical trial phases were overlapped, so to speed up the process. Which is why people think that they were developed so fast. But tens of thousands of volunteers participated. Over millions of doses have already been administered. So the vaccine is definitely effective, proven to be safe and effective for people. Even after the approval with the FDA, it's continued to be monitored and to make sure that it stays safe. As far as side effects, people do experience mild to moderate side effects with the COVID-19 vaccine, and it can consist of a sore arm at the injection site, redness, swelling. Some other common general reported side effects can be fatigue, muscle pain, headaches, but they usually resolve in a matter of days. Myths and facts and myths. Were there any questions regarding these?
Not that I see at the moment. Does anybody have any questions on anything we have discussed so far?
As far as the facts versus the, I just think that it's critical for people to know where to get their information from, make sure it's credible. Resources, if they can speak to someone with medical education background in regards to their concerns. There's so many myths in regards to the COVID-19 vaccine, such as microchips being placed in them, that there's several that they track. The COVID-19 vaccine were developed to track people, which is not true, that the ingredients inside the vaccine are dangerous and harmful. And they're not. The COVID-19 vaccine was developed to just reduce severe illness, slow the spread, and just like you wear a seatbelt in a car, that extra layer of protection from being injured in case of a car accident. The COVID-19 vaccine is to give you that extra protection to build immunity. Sorry. You just said, oh, I just.
And then these are just some resources that we have online at our Vaxability Strong website. So if you go to disabilitysa.org/vaxability, you can find all of these different videos on how mRNA vaccines work, Any questions, vaccine safety, misconceptions and questions, and all of that can be found on our website. Does anybody have any questions on what we've gone through so far? You can enter them in the chat, or if you'd like to, you can unmute yourself as well. Okay, if nobody has any further questions, we are going to move into COVID-19 impacts. And I'm going to turn it over to Dr. Wu.
Hey, so we're just gonna go over some of the statistics really quickly, and I guess I'll just tell you next slide when it's time. So you can go to our website at covid19.sanantonio.gov to see updated versions of this at any given time, but when we look at our cases over the last 14 days, you will see that it's concentrated more on the south side of town, which is how it has been throughout the pandemic. Next slide, please. And then this is death rate. So it's the same thing. You can go to our website and find your own zip code. Next slide. We have now added the percent boosted to our website. So among people who are eligible to be vaccinated, we're up at 76%, which is good. But then the percent that's boosted is only 37%. When you look at the whole population, so not just people who are eligible, we're at about 70, actually more recently than this slide, we're at about 72% for fully vaccinated, but only about 27% for boosted. Next slide, please. And as a reminder, if you don't have your booster, then you're not up to date. And especially with Omicron, just the original series, we find it's not as strong a defense as it was a year ago today. You can also find the, I'm not quite sure what I'm looking at here because I can't, okay, well, thank you. You can also find the map version of the data that I was just saying, so you can find your zip code and see who's gotten at least one dose. We see the same health disparities that we've been seeing all along. Next slide, please. And then getting more specific about what we know about the disability community and COVID. The data are limited because the definition of disability is different from study to study. And sometimes that information is not collected, as you all know, but a proxy can be to look at people with IDD, and in a large hospital data set, when we looked at people with IDD, people were almost 6 times as likely with that disability to die of COVID than people without IDD. Next slide, please. There's also a UK study where instead of asking about disability, people were asked if they were limited, not limited, limited a lot, and people who were a lot limited were also 5 to 8 times more likely to die during COVID. So, and in each surge, well, more than half of COVID deaths were among people with a disability. So that's a huge effect there. Next slide, please. And another partner of ours frequently is CI Now, Community Information Now, and you can see that when we map out people living with a disability, you see a lot of the same areas, zip codes that we saw on the other slides when we looked at deaths. Next slide, please.
Okay, we are going to open the conversation up. I do see some questions asking about the gift card. Yes, we will have surveys that we can send out to get you entered in for that gift card for your participation today. Does anybody have any questions on the current trends of COVID-19, the impacts in the community, or anything having to do with impacts to the disability community? You can enter your questions in the chat, or you are also free to unmute yourself and ask any questions that you may have.
Yes, I have a, go ahead.
Go ahead, Mary.
Okay, I just wanted to ask, I mean, I've been wearing my mask and I'm gonna continue, but some of my family members, I don't know, I guess they haven't been wearing masks, and her son is a high risk, but I think they're okay. What would you suggest? I mean, I know the answer, but I'm just asking, what would you suggest that, I don't know if they got vaccinated though. I know I have all my vaccinations. But after 2 years, they got the, the virus, because I guess, it's still out there, not a big percentage, but,
I would like to take a shot at that one. So especially because of the last thing that you mentioned, that it's not out there. So by the way, officially this week, we went from a low community level to a medium. So it is more out there. We are seeing more than 100 people in the hospitals now, which is not a high number, but it is bigger than it was, a month ago. And the real difference is that now you've seen that there's a disconnect between the number of cases, which is like 500 a day. I don't know if you remember in 2020, we were having 500 cases a day. Our hair was on fire, right? Now we have 500 cases a day, but not a huge increase in the hospital. So we are seeing that uncouple, which is what we wanted. That's what's different about this part of the pandemic.
okay.
But you're right. It's important if they're vaccinated or not. It's important if they're boosted or not. It's important what their own health status is, and it's important how much risk they're comfortable with. If we all have the right to take risks with our health and make choices that other people might not think are wise choices, but because everybody has different values. But you have to have the right information to make those choices. So people need to know that the virus is still around and that we don't know how long the immunity from either vaccination or from having an infection lasts. So we are seeing, for example, people who have had Omicron twice now, because you just get the infection back to back. On the other hand, if they've been vaccinated and boosted, they're not getting terribly sick, but it does, it does put you out of commission for a little while, right?
Because that's what I heard too, that a lot of people that had the virus before, they're getting it twice, and you answered my question. Okay, thank you.
To see someone in the chat who is eligible for the second booster at this time.
I can take that. So individuals that are 50 years and older can take the second booster. And I'm gonna let Dr. Wu pick because I personally have heard, and I'm 50 years old at this point, that they should wait until the fall, until we have a greater increase. Hold off on the second booster.
Wisdom at the table, and the CDC actually has an official opinion on that, which I agree with. So I'm going to let Danielle
As far as who is eligible to,
so who's eligible, because there's a little bit more to add to what Sandra said, but also like, if I'm eligible for a second booster, should I get it right now?
Or wait until the fall?
I would get it right now, why not? It's the extra layer of protection, but also you do have to consider the flu season as well. So we would have to deal with that, but I think it's a personal choice and to consult with your doctor if you feel like if you should get it at this, right away, or if you should wait till a particular time. I think that is something I am going to look more into as far as timing of when is the best time to get your booster. But of course, you definitely have to wait until it's after, depending on when you got your first series as well.
So what I'm hearing, and including myself, because I fall into the 50-year-old, that should I wait and hold off until the fall, it's personal risk and kind of deciding what my personal health is and how I'm exposing myself and what my risk is in the community.
And just my personal opinion, I would definitely, if you're eligible at that time, it's been 28 days since and you're eligible for the booster by age, or you have a health condition that makes you eligible for the booster, I suggest getting it, because then time goes by or you forget and then you're exposed. So I would suggest getting it as soon as you can when you are eligible to receive it.
And as Danielle was saying, you don't have to be over 50. You can be younger and
have health.
Yeah.
Condition.
There was one other question here. If you have come in contact with someone who has tested positive, when would you show symptoms?
So we still say it can take up to 14 days. However, a lot of people have noticed that it tends to happen a lot faster with Omicron. And the other thing that wasn't part of the question, but I'll just throw out there, is when do you test if you're having symptoms? A lot of us are using the rapid home tests right now. And if they come to a box like this, then please remember that when you do that one test, you've only taken half the test. If you follow the instructions, it'll say, you do one, and then depending on the brand, wait 36 hours or wait however many hours, and then do it a second time to be really sure. I do recommend waiting, I wouldn't test the first day after you were exposed to someone. The CDC says 5 days. I know there's some experts who say 3 days, but wait a little bit. I've seen even people who have symptoms not test positive until a few days into their symptoms, and that's partly, let me back up. So when our vaccine is working, then we get exposed to an infection and our immune system reacts, right? And when your immune system reacts and then you're gonna feel tired, right? You're gonna feel some of those things that you might think are from the COVID, but it's later when people end up having the runny nose or whatever, that's when they're testing positive.
Does anybody have any other questions? Or do the panelists want to add anything additionally? Yes.
Is there any new news about 4-year-olds when they get their vaccine? Anything new? Yeah.
As far as for the 6 month,
Well, because if you're 5 years old or under, they can't get it, correct?
I believe recently, and I wish I would have prepared for that question.
Oh,
because I received a couple of more.
I can get it.
Thank you.
Yes, so an FDA panel did hear data and say that they believe that both of the brand's mRNA vaccines, so the Pfizer and the Moderna, can be used in that 6 month to 5-year-old age group. And the next step, just like with all of the other phases of rolling out the vaccine, is that the CDC is going to take a look at it. So they have a work group this weekend that's going to take a look at it.
I did read that Pfizer and Moderna are both going to have different primary series for it. I believe Pfizer will have a 3 series vaccine for that age group, and Moderna will have a 2 series that will submit it. So it'll be interesting to see how. Yeah. big population too, to vaccinate.
Yeah.
Any,
Good draft, yeah.
any other questions, comments, concerns? Okay, we will move on to our next series, which is, let me go to that slide. Okay, we're going to turn it over to Antonio Martinez and Sandra Imery.
Thank you. So how can we better ensure vaccine equity and access? And I'll start off there. One of the ways that we can definitely ensure equity and access is by engaging our community and our community members. That's always instrumental and so vital to include all demographic populations. What we're doing through San Antonio Metropolitan Health District is we're using data-driven and providing information to our immunization team, outreach team, and letting them know that we have a map of San Antonio and Barrett County, and we know which particular zip codes we have individual pockets of populations based on race and income that have a need or don't have access to transportation, or maybe the hours of the vaccine clinics do not work for them. So we're providing these pop-up clinics in these particular zip codes. So we are using data at the current moment to strategize and be intentional and deliberate and offering the vaccination to individuals. But going back, involving the community, involving individuals, specifically, individuals that have a voice, and we would like to hear from them, like in this forum, and know what avenues you are needing additional resources in. Is there another slide? I'm sorry, I thought I had different slides. Okay. So I'm going to lead into that equitability, also into inclusion, into everyday activities, and which involves practices and policies to identify and remove barriers. So, part of equitability is removing these barriers, which include the physical barriers, accessibility, accommodations, assistive technology, universal design, attitudes, and communication. And I'm going to let Antonio focus on that.
Thank you. My name is Antonio Martinez, and I work with the Alamo Area Council of Governments. One of the things we came across since we serve persons with intellectual and developmental disabilities was that a lot of the population, the IDD community, sometimes does not communicate with words. So our biggest barrier when COVID came out was how do we ensure a person who does not communicate with words, who does not have a guardian, really even wants the vaccine? How do we make that determination? And then foremost, how do we know which one they want? It was a struggle. You think, okay, there's this separation that we find ourselves here even today, that you talk amongst your neighbors and you're like, oh, there's vaccinated and unvaccinated. And then within the vaccinated, there's the Moderna people, the Pfizer people, and then the Johnson people. And we continue that filter. So we really want to make sure persons with IDD who did not communicate with words really had that choice and that decision making in doing so. So we partner with Disability Rights Texas, Texas Health and Human Services, our client's right officer at the agency. We came to a conclusion that for persons that did not have guardians, or maybe not a supported decision maker within their family that could assist them, we encourage service planning team meetings of anybody that's involved in this person's life, and really determined at that time with everybody in that room in advocating for that person while that person was in the room as well and made that determination, depending on their health history, medical history, their accessibility, their accommodations, or any kind of supports that they may have needed. So we made that decision at that time. As far as accommodations, Disability Rights Texas served the population that could not go out and wait in those long lines or in the heat at the Alamo Dome, or maybe going into HEB and it was just too much commotion going on. So they served and provided those in-home vaccinations. At ACOG, I was able to get a grant through Texas Council for Developmental Disabilities, and we were providing the transportation. And I strongly encourage any agency who's advocating for vaccination that you really come to you do your research before coming out with your own spotlight, so to say, and really think about the clientele you're serving and service the gap that's out there. Don't try not to double work. There's other things that people are duplicating, and it's great, but are we really serving the population, and are we really addressing the gap that needs to be addressed? So we provided transportation, and it wasn't just to Bexar County, it was in ACOG's 13 county service area. And we provided the transportation to the site of their choice. Somebody wanted to leave Bexar County and go all the way to Frio, and they felt comfortable, I was going to do it. I mean, we made sure that receiving the vaccine was comfortable for that person. In this age of technology, we really have to understand as much as we're putting out so much material, we have to consider the unfortunate fact that San Antonio is at a 6th grade reading level. And a lot of this health information is a little difficult to understand. And I find that very, very hard, especially with my family who's predominantly Spanish speaking. How do I translate this material into plain language that's in Spanish? And it's difficult, it's hard. So, I encourage agencies and nonprofits who are advocating for this to really consider the demographics that you're serving and really make sure that whatever material you're putting out there is accessible, regardless of a disability or not. And really consider any caregiver or parent, a sibling that's taking care of a loved one with a disability, to really consider and use person-centered thinking skills in determining what's best for that person in receiving that vaccine. Is it HEB, or is it a quiet clinic? Is it CVS? I know sometimes as parents and as caregivers, we think we know best most of the time, but sometimes we got to take that step back and really make sure that we're finding what's important to them and tying in what's important for them as well. So, thank you.
Go back to the previous slide. Okay, so now we're going to go into vaccine clinics and the resources to support access to vaccine. Go to that slide. I'm so sorry, but Lisa, can you give them the link? I think it's at the bottom that you covered. Chat. So you can definitely visit our COVID-19.sanantonio.gov, what you can do with vaccination. But if you go to our website, it does provide you with all the pop-up clinics. The pop-up clinics need pop-up, right? They're not in one fixed location, which is great for equitability because we're constantly moving according to the need of the community. However, if you go to the website, and this unfortunately you can't see it, but if you go there, it'll give you an interactive map that you can actually type in where you're located, and it'll give you all of the pop-up locations. Like Antonio said, a lot of the information that we present to the community is provided in English and in Spanish. And then we consider transportation, that is one of the, a big barrier to get there. So we do provide free transportation through Via, and you can call also Via, which is our mass transit here in San Antonio, to see what the nearest bus number is to get to the vaccination. In addition to that, you can also call the city 311, and that's a really, really simple if you don't want to navigate, if you don't have internet, if you don't want to deal with looking at these sites on the phone, call 311 and they can provide you with that information. And that's always my number one to go to because it's so simple. So call 311. The other thing that Dr. Wu mentioned is, we do have, we're in the third round of free home self-tests. And you can get up to 8 tests per person in the household. So actually, when I read that we're in the third round, I ordered for myself and my parents. So there is always someone like ACOG or someone that can definitely assist you on getting these free at home self-tests as well. I know it's not vaccination, but I just wanted to plug that in. One important thing is vaccinations are no cost. There is no cost, and we provide vaccination pop-up clinics during the week and also on the weekend. And then we also have external partners that actually do it in conjunction with other organizations and even on Sundays. So if the hours don't work, or if you can't go to CVS, Walgreens, HEB, look at our website to get that information. And we also provide free HEB gift cards. I don't know if we're still at $100. Do you know that?
For the time being, it's still at $100.
Is it still at $100? So that is definitely after the second dose of Moderna or Pfizer, or after the first dose of J&J. But also at these pop-up clinics, besides the COVID-19 vaccination, we're also doing flu shots. So, you can do, and I think Dr. Wu, if I'm not,
they will expire June 30th. So we'll be done with flu season at June
30th. But I think that you can do both, co-administer, you can both, so that's something to consider. If you're like me, it's like, just let me have all of them at once. So let me feel miserable for a little bit, but I get all of them at once. And then we also have the boosters. And then the back to school immunizations at the pop-up clinic. So definitely take advantage of that. So you have the COVID, the boosters, the flu, the vaccine, and the children immunization. So you can all get vaccinated. All you need is a lollipop, right? So that's something in a couple of Band-Aids. So I don't think I'm forgetting anything. No. Can we go into the and tools to help you be prepared? I don't think I have a slide.
I don't think there is. Oh, yes, we do. Is that the one? No, that one.
Definitely there's resources, like I said, 311, our website, Disability SA, ACOG. There is always information that is out there. It is basically how you want to receive that information. So if you want to call 311, if you want to look at our website, if you want to call ACOG with the city of San Antonio, that information is up there. But how to definitely prepare to go to a vaccination clinic. Always take your vaccination card. That is very, very important. And always allow time that after you receive the vaccination, there is a waiting period of 15 minutes. And in addition to that, some of just the uncomfortable side effects of getting a vaccine, a sore arm, a little temperature. I personally get tired. I get a little runny nose for the first day, second day, and then so I try to, like children, I try to take the vaccine, let's say on a Friday, so I can feel crummy on the weekend and then go back to work, because that's something to consider with marginalized communities. If you think of work, right? We can't miss work. We don't go to work, we don't go get paid. So try to strategize on how to prepare to get that vaccine, and understand that you're going to feel a little bit crummy for a little bit. Not everybody will, everybody's different. But that's definitely a way to prepare for that.
Do you have right here, ConnectAbility puts the City of San Antonio website link at the bottom of their weekly email blast for people to access information. And then also, are the second boosters available at the pop-up clinics?
Great question. Yes, the second booster is available, and I personally have been contemplating on taking the second booster, and that's why I'm kind of gauging today, and I'm probably taking it at one of the pop-up clinics next week. But the second booster is available, and thank you, Disability SA, for providing that resources as well to your community.
Does anyone have any questions on anything we discussed? Yes.
Will there be a third booster?
So well, it all depends on how quickly, will we at some point, you perhaps need some additional booster? I think it's highly likely. But I don't know when it's gonna be. That depends on what the timeline of the vaccine makers is. So actually this ties back to the whole question about, gee, a second booster, why are people kind of lukewarm about the second booster? Why have you not seen as large a push for it? Well, some of the data that we have shows that it lasts less time than the first series and that first booster. And that's why you can, some specialists would say, including the CDC, if you want, you can try to time it. Like I happen to have gotten mine actually just this past weekend because I'm going on a trip in about 3 weeks. So I'm trying to time it out. And if you feel like, boy, you know, I'm fed up with boosters, and if I get this one, I'm not getting another one, well, then maybe wait and see, you know, what happens in the fall, because we do see more. We in the past, we've seen surges in the fall. But what the vaccine makers are working on now is something that's Omicron specific. And that way you won't be getting another booster that's, I mean, all these boosters are the same and pretty much as the vaccine that you were originally given, while the virus has been mutating and mutating and mutating. So my hope is that by the time something else comes out, it's also a little bit closer to the way the virus is. It has changed.
Any other questions? Anything anybody wants to add, panelists?
Can you explain where you were saying that if we do a home test, we have to actually do the second one, or I didn't quite understand that.
Yeah, a lot of times you just think, well, I take this test, I'm done, right? But the instructions for most of the ones that come two to a box. Now I know there's some that people got by through the government program that were 5 to a box, so that's different. You gotta read the instructions, but it will explain that if you were exposed, or if you have symptoms and your first test is negative, that's reassuring for now. And you also need to do another test just to check later on when maybe the level of virus in your body's gotten a little bit more detectable.
To reassure that it's still negative or positive, is that what you're saying?
That's right. That with just one test, you might miss it, but with 2, you're less likely to.
Okay. Yeah, I have 2, but I haven't gotten the other ones that they told me in the mail. But I'll have somebody help me sign that up, because I have trouble with this tablet of mine and signing this or signing that. So, okay.
We do have some other things in the chat. Leela Pharmacy clinics are sensory friendly and accommodating to persons with disabilities. We provide $50 gift cards for first and second doses, and they're a partner with Metro Health, and they provide free COVID home tests at their pop-up clinics as well. Other question here, if I have received the first and second vaccine, can I get another vaccine and not the booster so it will last longer?
It's not that the booster doesn't last as long because of what it's made of. It's because of our body's reaction to it. I mean, so vaccines are designed to teach your body how to respond to an invader. And so the first one is, here's what the invader looks like. And then the second one's like, hey, do you remember? And then the third one's like, hey, I asked you about 6 months ago, do you still remember? But you get diminishing returns with the same one over time. It doesn't have to do with the product. It has to do with the way our immune system works.
Any other questions?
Dr. Wu, can you add insight on the test to treat?
Oh, people should know about, yes, so we do have a test to treat center that's free. So in January, when people were getting lots of infections, it was very hard to find medicines. There are medicines now. Actually, in January, there are medicines, but they were just flying off the shelves and nobody could get them. And there was this whole challenge that people faced where it's like, well, first I have to get an appointment at my doctor's office. My doctor can't see me until next week. And then after that, the doctor's got to write a prescription. Then I got to go find a pharmacy. So we want to put everything in one place. That's what a test to treat center is. You get tested and you get treated all in one place. And there are two in San Antonio. One is up on North San Pedro. What is it? I'm not going to remember the exact street address, but it is on our website as well. When you go under testing, it's the San Pedro Test to Treat Center, and they have people who can give you the prescription. They do a rapid PCR test, so you'll have results in about 20 minutes, and they have people who can either give you a prescription for either of the two medicines, or they also do have the monoclonal antibody infusion there. And then the other option on the south side of town is Central Med's Palo Alto location. Now that one's by appointment. The other one on San Pedro is just walk-in. But they are free. Even if you get a prescription, you go into, the pharmacy to pick it up, it will be free right now because we're still in a public health emergency.
Any other questions?
And don't wait too long. So here's another thing that we hear all the time. Somebody, and especially my hospital colleagues, somebody says, well, I feel fine, so, I'm not going to worry about that test. I got stuff to do. And then day 7 or day 8, suddenly you don't feel so good, or you're in the emergency room. So a lot of the medicines, not all of them, but most of them really should be started within 5 days of when your symptoms start. So if you already have other things that make you at risk for being hospitalized, if you have COVID, like you haven't had your booster also, or you have other medical conditions, then I would definitely take advantage of the test and treat centers sooner than later.
We have, where can we go to pick up the free at-home test?
So there is a website,
COVIDtest.gov.
COVIDtest.gov, thank you.
And it's a simple website. You just put in your name, you put in your address, and you click the button and it's sending the test to your home. It's nothing you have to register or sign up and make an account. You just put in your information and it will send out the test to your home.
But if people don't want to go all the way there, I think what the person is referring to.
Oh,
I think it's
Physically pick it up.
Oh, .gov.
COVID
So sorry.
tests with an S, I think .gov. But I think what the person was referring to is I thought I heard you mention that sometimes we have free tests. Leila definitely says they have free tests at their Leila pharmacy.
Any other questions?
I have a question. I've been hearing more and more about long COVID, which I do and your mom could get it if you get COVID multiple times. So is there a way to be prepared to avoid getting that, other than avoiding getting COVID and being vaccinated?
I want to answer that, but I also thought of something else I didn't say about the free test. If you're lucky enough to have health insurance, the way I do, the way I get my free tests, you can get up to 8 a month, or as long as we're in a public health emergency, is you take your insurance card up to the pharmacy and they will give them to you there. Now, it's not any pharmacy, depending on what kind of insurance you have to call them and they'll tell you, you know, go to this particular kind of pharmacy, but that's another way. So long COVID is still being defined. I feel like I spend the whole pandemic saying, we're still looking at it, because the normal course of scientific research is, you know, we do these things years, over a process of years. So vaccination does help you not get long COVID, whether it's partly because it helps you not get COVID, but in addition, I'd say there's a decent but not definitive body of evidence that even on top of that, vaccination just helps you, if you do get COVID, not get long COVID. And long COVID is probably going to turn out to not be one single thing. It's going to be, you know, for some people, it's because I was in a hospital for a month, and so now I have all these different illnesses that come with having been hospitalized. For some people, it's because my immune system kicked into overdrive, and now I'm having these issues that have to do with immune problems. So it's a collection of things, and to prevent it, yeah, I don't know of anything besides not getting COVID that helps us avoid getting long COVID at this point.
Any other questions? No. So we do have several resources on our website at disabilitysa.org/vaxability. We have just information that you can click on that gives you more info on COVID-19 vaccine. We have social stories that help prepare anybody that has, you know, if you need it in Spanish or if you need it in English, we have social stories to help with the process of how to get a vaccine, which is really great in preparing children or preparing people with IDD, people with autism in getting their vaccine. We have the information on how to get support for people with disabilities. If you're looking for a vaccination clinic, if you're trying to schedule, get tests, COVID home tests, you can call the number, or you can visit, or you can email dial@n4a.org, as well as those websites we added in the chat. And then, as we mentioned before, you can also get free transportation provided by ACOG, and you can just contact them, or you can also find that link on our website. We do have a few accessible vaccine clinics coming up provided by our Vaxability Strong program with Disability SA, along with partnerships with SA Metro Health, University Health, and Lila Pharmacy. Our first one is actually tomorrow from 10 to 2 p.m. at Cornerstone Christian School off of Northwest Military Highway. It is free. We will have ASL interpreters, Spanish language interpreters. We'll have communication supports, a sensory-friendly escape room, and then as well as, you know, just a safe space for you to get your vaccine. It is completely free. You can just stop by. We will be there. And then we also do have 2 other ones that we will be doing at the Yanaguana Garden at Hemisphere on June 25th and July 30th from 11 a.m. to 1 p.m. It is a part of our inclusive programming, so you can come with your family, go through inclusive programming, get a vaccine if you want, it's for free, and then, you know, just have fun. Other than that, any other questions, any insight, Anything that anybody would like to add, a part of our conversation?
So there's another chat.
Oh, there's another chat, yes. Let's see. How long will they keep doing the free clinics? That's a good question.
Yeah, I don't think we have an answer to that. It really does depend on what happens with cases, what happens with federal funding, let's be real. What happens with the need in our community. I mean, like, in a perfect world, suppose we got more than 90% of people vaccinated. I don't think that'll happen, but then, you know, the motivation's a little less there, right? So short answer, not sure. So take advantage of it while it's here.
Any other questions, insights, comments, concerns?
I have a question.
Yes, go ahead.
If you get COVID, I was told that if you get COVID, then you're good for like 90 days. Don't have to worry about getting it again. True?
So 90 days. So for the longest time, well, including for the longest time, including right now, the CDC says that you are at low risk for the 90 days afterward. However, I think that is something that could change over time. I mean, like I said, anecdotally, we've seen cases both locally and nationally where people have gotten Omicron twice, sometimes within the same period of month. Yeah. So I think the landscape is changing and you may see updates to that information.
Any other questions? You can put them in the chat. You can unmute yourself. It is an open space for open conversation.
I've got a question. Is there a limit on how many free COVID tests we can request?
To my knowledge, it's 8 free tests per month. I guess depending on where you're ordering from. If it's through your insurance, your health insurance, right now through the government, to my understanding, there's only 8 per household, not per person, 8 per household. And I believe they send it, they give you 4 at a time.
Yeah, now if you heard before, then it might be more than that.
So now I haven't ordered since the second round, so.
Right, so then you might be able to get
another set.
Yeah, another set, yeah.
Any other questions?
What about, what about the uninsured? You know, we do have San Antonians that are on the Bear County health system care link. Can they go to a university hospital pharmacy or one of their,
and like we mentioned, Leva Pharmacy, she's offering, their clinic is offering, you're talking about for COVID testing?
Right. Well, you know, the university health system pharmacies offer patients that are on CareLink free COVID tests if they show their CareLink cards.
So CareLink is not meant to be used as insurance. I know people essentially do that, but it's not covered by that federal rule that says all insurance companies have to get the 8 tests. Now that's not to say there might not be other ways through CareLink or through university to do it. So it's worth asking. And then in addition, take advantage of the free federal ones, take advantage of LELA. And if we do end up having a big surge, we might have some in our back pocket over at Metro Health too that we're sitting on top of.
Did we have another question?
I think someone.
Yes, Danielle.
yeah,
Yes, go ahead.
I'm sorry. I came late. I might have missed the topic about the accuracy of the at-home test. How accurate are those?
They are extremely, they're accurate when you're having symptoms, when used as directed. So there's a lot of clauses in there. I don't know. I haven't seen a study about how accurate they are with whatever typical use is, right? But in studies, you know, at 80%, 90%, really very respectable numbers. Especially for when you have symptoms, with, you know, a higher, like 90, 95+% range.
Okay.
Any other questions?
I have a question.
Yes, go ahead.
With the new strand symptoms being so much like allergies, when do you know when to test?
Yeah, that's real. That is real. So, yeah. Sometimes you might have more concern because of it. You know you were in contact with somebody, or you went to some bigger event and then you develop symptoms. But you know, yeah, so we probably, none of us has enough tests to test every time that we have symptoms. If you do it 5 days out from when you were exposed, or if you're starting to have symptoms that seem a little different than what you're used to having with allergies, you know, like maybe you're not a person who usually gets a sore throat with allergies, but now you do, right? I mean, those would be reasons to do it a little bit sooner. If you get a test and it's negative, I would actually continue to take precautions to protect the people around you as if you might be positive if you're having symptoms, and then wait a couple days, like really two, like don't just test again the next day. But wait 2 days and do the test again, or maybe 36 hours, or actually whatever it says in the box. Forget what I said about 2 days. Do what it says in the instructions. Do what it says in the instructions, and go with that. Speaking of testing, we use, you know, the test to treat centers also do testing. So if you have symptoms, then that is a way to get yourself a PCR test if you're concerned about the rapid tests.
Any other questions?
I have another one.
Yes.
With the home test, how do you know that you're doing it accurately by sticking it up your nose? And how, I mean, is there a way to know if you're going far enough, or?
Usually in the instructions, it actually says how far, and then you have to find a ruler and measure it down if you want to be really precise and not eyeball it, or you're not, it's probably in metric, right? It probably says like 1, or, you know, however many centimeters. So yeah, it might take having a ruler to get to know that the first time.
Okay, I just know everybody's nose is different, so you go an inch or ½ inch.
Ah, I see. So you're saying within that range, like if it says 2 to 3 centimeters, do I choose 2 or 3? So way back at the beginning of the pandemic, when people were, you know, when it was like tickling your brain to get tested, the Gates Foundation actually is the group that did the study that said, hey, it turns out you don't have to stick it that far up your nose. And specifically, you're looking for what's called the well, I'm not gonna go through the anatomical term, but most tests are asking you to go, and I've got a mask on, I can't see.
To the crease, right? To the crease here.
Yeah, that's a good way to describe it. Thank you, Danielle. Okay. You don't want it to stay right on the outside. There are some tests that are marketed for that, but most of them you have to go up a little bit higher. But you don't have to go up so high that you'll give yourself a nosebleed.
Any other questions?
In general, like let's say, I don't know, if you test negative for COVID or someone does and they stay away the 5 days or more without symptoms, is that safe?
So they're negative and they're staying away? That seems super safe.
Well, because see, my sister got COVID because her husband is a truck driver, and I guess they had mild symptoms. So she still showed positive, which we know that's an occurrence. So in general, how long would you recommend that they stay away from family, because it could still show in the immune system, you know? I don't know exactly what her health issues are, but I do know that where it'll show positive.
So what you're talking about is what seems like a very common sense thing that a lot of people do. In fact, a lot of people do under the supervision of their doctors, which is they test on the other end of COVID to see when they should be free of isolation. And actually the CDC doesn't recommend it. And again, things are going to evolve. This advice may change at some point, but certainly a year ago at this time, we saw lots of people who kept on testing positive, even though they were not infectious anymore, because, maybe the test is picking up some dead virus. So the CDC really just goes by time frames. And, well, it's time frames and have you been vaccinated? So
they said she got vaccinated, and then, after I guess the 5 days, they told her, well, you can come back to work. But I imagine she's still wearing a mask, and all that stuff. But I was just asking.
Right. Yes. So if you are up to date with your vaccinations, which includes the booster, then yes, you can go back after 5 days while wearing your mask the whole time. Because definitely even around 5 or 6 days, there are some studies that show you've got a decent level of virus still. But because it's become complicated, because it depends on, have you been vaccinated, and when was, are you up to date with your vaccinations, and what about your own health status? Are you moderately or severely immune compromised? If you can get online, then I recommend using the CDC's quarantine and isolation calculator, where you put in, it asks you questions and you answer them. Now, I know not everybody's big on using computers, so the general rule is, well, there's not a general rule. But if you call 311, someone will help you walk you through it. And if they can't answer it, then they'll send you to someone at Metro Health who can.
Any other questions?
I have a friend who just recently got COVID, and her doctor gave her something called Paxlovid. And she was telling me that her sister got COVID and was prescribed Paxlovid too. And I guess one of the side effects of it is that you can still test positive for 3 months after
even if you don't have, even if you're symptom free, you'll still test positive for 3 months.
So that's actually, that's two different things together. The Paxlovid, it is one of the drugs that can be prescribed now, and it's 89% effective at preventing you from getting infections. So, I mean, not getting infections, from ending up in the hospital. So yay. The most common side effect that I hear about is an unpleasant taste in your mouth from taking it. The 90 days, I'm going to guess that is combining that with what we were saying before about how the CDC doesn't recommend testing on the other end because you could still test positive for 90 days. Whether you take Paxlovid, whether you don't take Paxlovid, that's just, we recommend that you follow the time recommendations rather than use the tests to decide when you don't need to isolate or quarantine anymore.
And why are some doctors prescribing it and others not? Like, because I got COVID and my doctor was just like, okay, here's your inhaler for your asthma and go home and quarantine.
Yeah, I think that there's not enough, I wish that, people have different levels of knowledge and comfort. Some people have read, when the drug first came out, there was a lot of concern about possible drug interactions. There are 2 medicines that are in there, and one of them we've used in other areas of medicine for a long time, and it has some drug interactions. However, now, over time, we've seen that because you're just taking a short course of this medicine for 5 days, for most people, we're not seeing that as significantly, but it could, honestly, it could depend. Maybe you're taking a medicine that interacts with it, maybe your doctor feels like it's not, for whatever other reason, not the best choice for you. I would say you can ask your doctor, hey, what about, I've heard of this thing called Paxlovid, am I a good candidate? I sound like an ad. Am I a good candidate for it? Also, speaking of things that doctors don't prescribe enough, there is also something called Evusheld, which is for people who are not candidates for vaccination, or are extremely immune suppressed and aren't getting the benefits of vaccination. Like, that they've been vaccinated and had their boosters, but you also just know that because their immune system is so weak, that they're still kind of vulnerable. And that is also something that people can ask their doctors about. And that's a preventive. So before you get sick, you can take that.
Does anybody else have any questions? Okay. We are coming up to the end of our discussion. For more information, you can visit our website, disabilitysa.org/vaxability, or you can email us at vaxabilitystrong@disabilitysa.org. Today's community conversation was made possible through funding from Texas A&M Health and Texas Department of Health and Human Services. We do want to thank ConnectAbility for hosting us here today, as well as ACOG for collaborating. And then we also want to say a special thank you to San Antonio Metropolitan Health, Disability Rights Texas, and University Health for their participation today. All of our wonderful panelists, thank you for your expertise, for your knowledge, and for helping us learn more about COVID-19 and disabilities. And then just a few of our media sponsors. We want to thank the San Antonio Observer, Texas Public Radio 94.5, and KLRN. If there are no other further questions, concerns, or comments, we will go ahead and end our meeting here. We thank you guys so much for participating today. We do have free materials outside. We have sanitizers, extra materials from our program today, face masks. Please take as many as you'd like. If you have any questions, our health experts are here as well. If there's anything further that you want to discuss or ask, they're here to help. Thank you all online for joining us. If you have any other questions, please feel free to reach out.